Hey guys, welcome to Man Medicine, where we talk about how men can optimize their health and escape the collapsing U.S. healthcare system. Today, guys, I want to review a paper that came out from the Androgen Society. That's Dr. Abraham Morgenteller's organization. That it came out in the fall, and I've been meaning to get to this and talk to you guys about it because I haven't seen much discussion about it on the YouTubes and the Instagrams and whatnot, but I think it's a very powerful paper. And the conclusion at the end, I agree with wholeheartedly. And I think it's worth reviewing just one last time, because the subject of testosterone and cardiovascular disease, this is something that just will not die in the mainstream medical community. I do feel like it is getting better with the Traverse study and the mountains of evidence, which are all well documented in this paper, by the way, that show that testosterone replacement therapy is beneficial for men. And particularly men with hypogonadism in terms of reducing cardiovascular risk. It's the amount of data showing that is overwhelming. But despite that, I mean, I still hear, even from my colleagues, these myths being perpetuated about testosterone being potentially harmful, about increasing the risk of MI, increasing the risk of stroke, increasing the risk of DVT, deep venous thrombosis, pulmonary embolism, etc. In fact, this actually just came up like in a casual conversation with the internal medicine and cardiology team where I work just a couple of weeks ago, and a man who had been on testosterone and came in with a cardiovascular complication, which was completely unrelated to him being on testosterone. But I heard these other physicians immediately, like, they just laser focused in on the fact that he had been using testosterone, and which is a shame, because I think when that happens, and it happens a lot, it shifts attention away from more the actual causes for this person's event, and causes perhaps physicians not to do a complete workup and to just assume that this is a testosterone related thing. So this still happens among very well-trained internal medicine, family physicians, cardiologists, etc. Again, the tide it's slowly turning. I don't hear this as much as I used to, but listen, this is still out there. I still hear from patients that their family physicians and internal medicine physicians who are taking care of their primary care still are perpetuating a lot of these testosterone related myths, and not just cardiovascular ones, but, with, in terms of prostate issues, etc. People listen to their doctors. These doctors are basically frightening patients away. And it's often the patients that would stand to benefit the most from having their low testosterone treated because of these, because they trust their doctor, and, they're coming from a perceived position of authority and knowledge. They avoid a therapy that could be incredibly helpful for them. And that's unfortunate. But the fact of the matter is, there's a tendency among physicians, and I really try to be careful to not do this, but I think all of us are guilty of it at times. And that's not staying in our lane. One of the things I tell residents and medical students that train with me is it's okay to say, I don't know. Perfectly okay. Nobody knows everything in medicine. Yet there's a tendency, I think, in the medical world, and physicians, that they want to be perceived as knowledgeable, and they want to be perceived as having all of the answers. So they tend to say things that they don't have expertise in. I'm board certified in emergency medicine. I'm board certified in family medicine. So I've been doing this for about 25 years. So I have a fair amount of experience. I have a fairly broad knowledge base, but, there are areas where I have a broad knowledge base, but in certain areas it's not as deep as in others. So, you're not going to catch me giving in-depth obstetrical advice. You're not going to catch me giving in-depth pediatric medical advice. I'm not a neurosurgeon. Okay. Don't ask me about your brain tumors. Don't ask me about spinal cord problems if they're outside of the scope of what a good emergency medicine physician or good family physician would know. That's my lane, and I do my best to try and stay in that. But I hear it all the time. You hear, stories about physicians that, and then again, this relates to testosterone, where, they have literally no expertise. They have no knowledge in testosterone. They only They only know what they've heard from the media or what has been perpetuated by their colleagues or the physicians who trained them, often back in the 1980s, where they knew absolutely nothing about testosterone. And so they just perpetuate those myths. And unfortunately, they still train medical students and residents, and they pass it on to this next generation of doctors. So again, I think it's getting better, but you still see you see comments like this. I found this video is like the perfect example of this. Someone who comes off as who's a physician and who on camera sounds like a knowledgeable and trustworthy individual, but they're putting out and perpetuating content like this. Again, I'm not putting this on there to ad hominem this person or to directly attack them. It's not important who they are. But just listen to what she has to say about testosterone, and I think you'll see.
Testosterone is actually a scheduled drug. It is on the same level as a pain medicine, and it has to be prescribed. But yet, I have seen several of my patients that take over-the-counter supplement, and we do their blood work, and I see testosterone high level in their blood work. And why is that dangerous? Because high level testosterone can be dangerous for not only your heart, but also your prostate as well too. And they need to be monitored on a frequent basis because testosterone can convert to dihydrotestosterone, which can affect hair loss as well as enlargement of the prostate. It can be converted to an estrogen, which can cause you to have fat deposit on your breasts as well as your love handle. So very serious side effects that should be monitored by a physician and from blood work.
Okay, well, there you have it. Literally everything she said in that video is completely incorrect. But, this individual has thousands and thousands of followers. And people that will listen to her. And so, she's saying that high levels of testosterone from a natural supplement, which, by the way, guys, there are no natural supplements that will raise your testosterone like that. Stop wasting your money. But she's saying that she sees it and it's dangerous. It's dangerous to naturally raise your testosterone using a supplement. And presumably it's dangerous to take testosterone for all the reasons that she said. But, again, you watch this channel, right? You know that this is nonsense. It's complete nonsense, but this is what doctors are still saying to their patients sometimes. So the question is, where does this myth come from? And that's where this excellent paper comes in. We'll talk about it here. So Mayo Clinic Proceedings, Androgen Society position paper on cardiovascular risk with testosterone therapy. Again, first lead author here, Dr. Abraham Morgentaler, the OG of TRT in many respects. Those of us in this field of medicine who use therapeutic testosterone to treat hypogonadism, I think we all owe Dr. Morgentaler a debt of gratitude for he spent his entire career essentially debunking a lot of the myths about testosterone. So this is fairly hot off the press. Came out in November 2024. It very eloquently debunks the myths that this previous provider that I showed you just casually threw out there, and it does so in a really well organized and systematic way. This is the kind of paper that if you've got a good relationship with your primary physician and you hear them saying things like this, you could absolutely print this out and give them to them. Again, be professional. Just, don't be a jerk about it, but don't try to make them feel stupid. Doctors don't like that. But just this is something you can share with them because I think if they take the time to actually read it, they'll see that all of these previous beliefs about testosterone are just not supported whatsoever by the literature. So how did we get to this place where these myths are now so firmly embedded in the medical world? And they've been around forever, obviously, but a lot of this came from two studies back in 2014 and 15 that the media got a hold of it. And of course, when the media gets a hold of something like this, there are a number of, predatory law firms that start seeing dollar signs. And so they initiated a number of class action lawsuits against the makers of various testosterone products because they see dollar signs. So there was a lot of damage done as a result of the media spin on this. And I was able to go back on YouTube and actually find some of the media coverage that was occurring around this time. And so I want to show you a clip of that just to give you an idea of the hysteria and the nonsense that people were spouting, not just reporters, but, physicians as well. So they were all these hit pieces on testosterone. And, doctors are, they like to think that they're immune to media, that they're immune to all the things that sway the general public, but they're not. And I'm not either, although I do my best not to be. But this media campaign influenced physicians just as much as it influenced the general public as well. So take a look at this clip, and I'll let you guys come to your own conclusions about this. I find this really, in hindsight, it's just amazing.
Now with a new warning, it's being called the biggest men's health craze since Viagra. But tonight we're finding out if taking testosterone is risky to your heart.
Ronald Martin likes to stay in shape. He spent years in the service and now works out in the gym. So when he started feeling fatigue and less drive,
I went and saw a doctor and got tested for low testosterone. And I was asked, hey, do you want to start this new regimen? It'll help boost your morale. It'll help boost your sex drive. It'll help you make more energetic in the gym. So I was all on board.
Ronald says he took the gel form of testosterone and was put on a 6-month regime. And he says it worked.
I did have some good side effects. My morale was boosted. I did feel more energetic, so I was excited.
Until, he says, he started having health issues.
Recently, I noticed I started having chest pains, so I started doing research into testosterone and some of the side effects it may have.
Testosterone, the one that we create, actually might have some side effects. In heart-wise, it can cause, it has probably a higher incidence of strokes, higher incidence of heart attacks.
The FDA is now officially investigating the potential that FDA-approved testosterone products can increase the risk of serious adverse cardiovascular events. And they're citing 2 different studies.
I know that the first study, they included about 55,000 men, and there was a higher incidence, up to 30% of heart attacks, both fatal and non-fatal myocardial infarcts in the population that used testosterone.
The other study showed similar results. Ronald stopped taking the testosterone and contacted a lawyer. His goal now, make sure patients are warned of the potential side effects beforehand.
Studies show that there are 3 times the amount of having a heart attack in certain folks when they're on this type of gel, and we don't want Ronnie to be one of those statistics.
Ronald is being monitored by a doctor. Attorney Eric Seidel is looking for any other men who might have had similar experiences. If you'd like to get in touch with him, head over to my Facebook page, look for Linda Hurtado, WFTS under pages, and like the page. I'll link you to him.
Did you guys catch that at the end? Did you guys catch that? So this ABC reporter, Linda Hurtado, at the end of her session here, where she's supposed to be reporting the news, is recruiting clients for this attorney who is suing the testosterone companies. So, Linda, who do you work for? Who do you work for? Do you work for ABC, or are you getting a little bit of on the side there from these attorneys by recruiting plaintiffs? If you want to get a hold of the lawyer, you call the ABC reporter and she'll put you in touch with them. Wow. So anyway, this whole thing is to me, is just totally sickening. And honestly, the worst part about this was the cardiologist. They got the chief of cardiology at some random hospital there, who I kind of wonder if he actually even read the study. After what I tell you, you're going to question whether he actually even read this study. So again, there's this air of authority. This guy, he's a cardiologist who are obviously extremely knowledgeable about all things cardiac. And he's the chief of cardiology. So this is somebody, honestly, in most circumstances, I would listen to him as well. If I had a cardiology question, I work with cardiologists every day. They're extremely knowledgeable and very helpful. But, in this particular case, everything that guy said was complete BS. Completely wrong. So regardless, as a result of these 2 studies, which I'll show you here in just a second, the FDA mandated a black box warning on testosterone products about possible increase in cardiovascular risk. What they also did was then they mandated these manufacturers to fund a large study to look into this. And what that study ended up becoming is the Traverse trial, or Traverse study, that now has come out within the last couple of years and shown the largest testosterone trial ever done in men who have serious cardiovascular risk factors and known disease. What did it show? It showed no adverse effects, no increased risk of events. But here's the thing, like the damage has been done by these two studies, and there have been dozens and dozens and dozens and dozens and dozens, and the list goes on. In fact, they're all listed in this article, which, again, I encourage you to look at. Dozens and dozens of studies showing benefit, yet it's taken that many studies and the Traverse trial as well to even like nudge the needle a little bit in the general medical community. So what were these two garbage studies that caused so much damage and caused so much misinformation? Well, these are the Vegan and Finkel studies. So 2015, 2016. The one here on the left, this is the Vegan study, association of testosterone therapy with mortality, myocardial infarction, and stroke in men with low testosterone levels. I think this was published in JAMA. And then here's the Finkel study, increased risk of non-fatal myocardial infarction following testosterone therapy prescription in men. And again, if you're like most people, including doctors, all you will do is read the abstract, or you'll go right down to the discussion and you'll read that, and you won't go into the details of the study, and you will be misled. You will come to an incorrect conclusion, which is what basically everybody did back in 2015 and 2016. So let's look at the Vegan study real quick. So they looked at men who'd had coronary angiography, okay, and then they followed them for 3 years after that, and they looked at outcomes. And they looked at men who had been given a testosterone prescription and those who didn't. Now, this study has been picked apart and dissected ever since it came out, and a host of mathematical and statistical errors have been found in this study. So much so that, it actually turned out that the study, when the math was done correctly, it actually did support the use of testosterone. It didn't show increased harm. It showed decreased harm. So they said that, reexamination of the data showed the T group actually had half of the adverse effects as the group that did not receive a testosterone prescription. So the other thing that just blew the lid off of this study and made it, in my opinion, need to go straight into the wastebasket. So they didn't just have sloppy math with their statistical analysis. Again, this was a study that was supposed to be looking at men on TRT. Well, it turns out that 9% of the test subjects were women. 9%. So there could be no meaningful conclusions here. Obviously, the investigators here were this is sloppy research, and it deserves to be thrown right into the wastebasket. So again, 9% of the male test subjects were actually female in this study. So that should give you an indication of like the level of attention and to detail that these researchers paid as they put this study together. It's pretty shameful, and I'd be embarrassed. I'd be extremely embarrassed if I had my name on this study. Okay, the Finkel study was just as bad. So this is a retrospective study of an insurance database. So it's like the worst kind of data mining. And they were looking at rates of non-fatal MI, like STEMIs and NSTEMIs, so non-fatal MI, in the first 90 days after filling a testosterone prescription. And then they compared that to the 12 months period prior to that. So right there, they're comparing apples and oranges. They're not comparing like these are not two comparable time periods. But the big problem here, one, there was no control group, and there was no other clinical data that was gathered. So they just basically, did you get a T prescription? Did you not? We don't know if you filled the prescription. We don't know the dose. We don't know anything about levels. We don't know the rates of other cardiovascular risk factors in these patients. So we don't know what percentage of patients in each group smoked. We don't know the percentage of patients who were obese, who had type 2 diabetes, et cetera, et cetera. So this is garbage. Like there really is no meaningful conclusion that can be drawn from either one of these studies. They're riddled with errors. And again, as I mentioned earlier, in the andrology position paper that we're talking about here, they take the time and they list as many as possible, many studies, all of which refute the findings of these two really poorly done studies, and show the mountain of evidence that testosterone, especially when given to truly hypogonadal men, can be actually incredibly beneficial. So this is a really, really good paper. And it ends with kind of a little bit of a mic drop statement here at the end, which I full-heartedly agree with. And So I'm just going to read it to you because it absolutely speaks for itself. So here we go. Conclusion. The Traverse trial, supported by an extensive prior literature, has found beyond any reasonable doubt that testosterone therapy in testosterone deficient individuals is not associated with increased risk of MACE, major adverse cardiac events. This has been studied in multiple populations, all with the same result, including in men 65 years and older who are relatively healthy in a diabetic and pre-diabetic population, and in men at high risk for MACE. Okay, this is where it gets good. We believe this is now, quote, settled science, end quote, and see no reason to expend valuable resources to investigate this further. Said 100%. This is the nail is in the coffin here, guys. We need to move on, and we still need to study testosterone therapy, but we don't need to be wasting precious research dollars and let alone taxpayer dollars on trying to figure out if therapeutic testosterone increases the risk of heart disease. The answer is no. It's definitive at this point, and we need to move on. So they finish up by saying it is the position of the Androgen Society that it has been conclusively determined that testosterone therapy is not associated with increased risk of heart attacks, strokes, or cardiovascular deaths. Boom. There you have it. So I completely agree. So this is a really good paper. I encourage you guys to read it. I encourage you to share it online. And even share it with your physician. If you've got a good relationship with your primary, go ahead. One thing I do want to end on, though, here's the thing. So this paper talks about therapeutic testosterone for the treatment of hypogonadal signs and symptoms. This final statement here, it does not apply to those of you guys out there who are under the care of these, I call them clown clinics. That's just my personal take on the way they practice medicine, who are giving you guys all of these adjuncts. This does not include men who are being prescribed oxandrolone and stanozolol and all of this other stuff. It absolutely does not include men who are getting aromatase inhibitor. It is entirely possible that you guys were following those kinds of protocols where you're taking other agents, specifically synthetic anabolic steroids, where you are suppressing estradiol. You actually may have an increased cardiovascular risk. It's just, you did not fall into all of these studies. This is men who are on therapeutic testosterone. All those studies show universal benefit with the exception of these two that I just showed you and a couple other ones that are older than that. But everything else, therapeutic testosterone is beneficial. And we cannot say that about you taking 300 milligrams of testosterone cypionate a week and 20 milligrams of oxandrolone and a milligram of anastrozole twice a week, which many guys do. I'm willing to bet that that's going to actually be harmful. If that were studied in the same way, then I think that would probably not show the same benefits as therapeutic testosterone alone. So having said that, feel free to disagree with me on that. If you like, I always appreciate comments from you guys, and I will catch you next time. Bye-bye.
All Man Medicine video and audio has been created and shared online for informational purposes only. This podcast does not constitute the practice of medicine or professional healthcare services of any kind, including the giving of medical advice. I am not your doctor. No doctor-patient relationship has been established. This content is not meant to be a substitute for professional medical advice and should not be relied upon solely for that purpose either. The only purpose of this content is to present peer-reviewed, research-backed health information for your consideration. As always, rely on the advice and guidance of your personal physician before undertaking any activity presented here, and if in doubt or not comfortable with said activity, practice discretion. Your health is your responsibility and not ours. Finally, I take conflicts of interest seriously. I accept no compensation whatsoever from any private corporations, including pharmaceutical or supplement companies. You can trust that if I recommend a medication, product, or service, it's because I genuinely believe in it and not because I'm being paid to endorse it.